young surgeon, Dr. Supriya Sriganesh, and she'll be operating on a 51-year-old male. NO1 and P1 is the cataract grade, and she'll be implanting a Hoya Impress EDOF lens. Over to the OT room.
So today I'll be using the 3D microscope, the Artivo 800. So as you can see, I have my 3D glasses on. Today I'm using a Hoya Impress lens of 23 diopters. So I'll be using the Centurion vision system today to operate on this patient. As you can see, he has a very soft cataract with a PSC. So I think the system is just getting tuned. So all right, we can start now. So simultaneous side port and main port incisions are my preferred technique, similar to what I've learned from my mentor, Dr. Sriganesh. We're using some intracameral Xylocard, which we use for all patients, and some Visco. I think the side port has just touched the capsule there, so I need to be a little bit careful while doing my rexis. Light and nottari sir, aramagiri. So just being very careful there, aiming for about a 5.5 mm capsulotomy. So just got to be a little careful and go beyond the point where that is touched, and we're good. So we bring it into the rexis, and that's it. So fairly good rexis there. Happy with that. Going to be doing a hydrodissection. You can see here, just looking for the posterior fluid wave, the nucleus to rise, tapping down on the nucleus and just rotating it gently. Since it's a very soft cataract, I'm going to be using a roulé technique or a cartwheel technique just to get this lens out. Let me try that. So here, very minimal phaco, very minimal phaco. So the lens just rotates into the probe. For soft cataracts, this is an effective technique. Not much phaco, just by vacuum. And just pick it up. Just with very minimal phaco, and that's it for the nucleus management. That's it for the nucleus management. So hardly any phaco. It's a young patient with a soft cataract and a PSC. I like using the coaxial IA. So here again, this is a straight tip. A fairly simple cortical removal. Those small fibers on the posterior capsule, it's very important to remove them, especially in cases of posterior subcapsular cataract. You just use a hydro to just wash it off the posterior capsule. Comes off very easily. A little bit of visco there before implantation. We've talked about this injector. It's excellent. You see, I prefer the push type feature on this injector, the multi-cert injector. Just slowly gliding the lens. Into position there. And I like to use the coaxial IA to just nudge it into the bag. And that's about it. So don't need to do too much. It's fairly simple. Soft cataracts also we use another technique called mechanical chop. This technique that I demonstrated was a single hand phaco roulette technique, which for very soft cataracts it works well. And the mechanical chop also works very well for soft cataracts where it's a little denser, maybe grade 1, not a completely clean nucleus with so all these little fibers, and you see that the rhexis overlap is good, the IOL is centrally placed. You can even go behind the lens and just clean up a little bit. Especially for torics, this is important to make sure that all the viscoelastic is removed and there are no remnants as such. And that's about it. Just hydrating the wounds and we are done.
Excellent demonstration and very nice technique of dealing with the soft cataract. Very well done.